Hi, my name's Nicole. I'm going to be your nurse today. What brings you in today?
A wellness visit.
Okay, so I'm going to be performing a head-to-toe assessment on you. Can you tell me your name and date of birth?
Alyssa Jacobson, 1996.
Okay, and do you know where you are?
The doctor's office.
And what year it is?
2019.
So the patient is alert and oriented ×3. Are you in any pain right now?
Nope.
Okay. Just from my general survey, I can tell that she's not in any respiratory distress. She said she had no pain. There's no nonverbal cues. She's presenting appropriately. Hygiene and posture is good. Okay, so I'm going to start with your head. I'm just going to palpate your scalp and take a look at your hair, looking for any lesions, masses. Your hair is evenly distributed. Now I'm going to palpate your lymph nodes, pre-auricular, and just let me know if you feel any pain or tenderness with this.
Okay.
Post-auricular, occipital, parotid, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. And no pain or tenderness?
Nope.
Okay. Now I'm going to palpate your ears. Let me know if there's any tenderness, pain. There's no drainage. Palpate the tragus. Okay. So now I'm going to take a look at your eyes. Okay. So I'm just gonna have you look at my nose. I'm gonna dim the lights. I'm gonna shine this light in your eyes. I'm gonna do the Perla test to see if your eyes are equal, round, and reactive to light.
Okay.
Okay, and her pupils are round and equal. They started at 5 millimeters, went down to 3, and returned to 5, reactive to light. Now I'm going to test your corneal light reflex. I'm going to do the same thing, but I'm going to make sure that they reflect each other. Okay, and they do. And I'm going to have you follow the pen light to your nose, just using your eyes for accommodation. Okay, great. Now I'm going to do the cardinal field of gaze. I'm just going to have you follow this pen light. Try not to move your head while you do it. Okay, great. And the eye movement was crisp. There was no involuntary movements. Now I'm going to take a look inside of your mouth. Can you open your mouth and say ah, please? Okay, you was midline and symmetrical. The soft palate was intact, symmetrical. Mucous membranes were pink, moist, and intact. Okay. So now I'm going to palpate each of your carotids one at a time. Okay, strong and regular. Okay, and now I'm gonna listen to them with the bell of my... Okay, just take a deep breath and hold it, please. Okay, and again. Okay, great. And I didn't hear any murmurs or bruise. Okay. Now I'm going to listen to your heart sounds. And first I'm going to listen with my diaphragm. First I'm going to listen to the aortic valve, which is right sternal border, second intercostal space, and S2 is louder than S1. And now the pulmonic, S2 is greater than 1, and it's at the left sternal border, second intercostal space. Then Erb's point, S2 and S1 are equal. It is at the left sternal border, third intercostal space. Tricuspid, left sternal border, fourth intercostal space, S1 is louder than S2. And then the mitral, which is mid-clavicular line, fifth intercostal space, S1, is greater than 2. And now I'm going to have you lean forward a little bit, and I'm going to repeat that with my bell. Aortic, pulmonic, Erb's point, tricuspid, mitral. Okay. And I'm going to palpate your apical pulse. Okay. And I'm going to auscultate your apical pulse while I palpate your carotid to look for any pulse deficits. Great. Cool. Okay, and now I'm going to listen to your lungs. I'm going to do 6 fields in the front, 2 on each side, and 8 in the back. Okay, and I'm going to have you turn around. I'm going to listen to your sides. Okay, great. And now I'm going to listen to the A and posterior. And here I would hear bronchial, and expiration. I'll hear it greater on expiration than inspiration. Then bronchofascicular, inspiration and expiration are equal. And then vesicular, greater on inspiration and expiration. Okay, great. And while I'm here, I'm gonna check for respiratory, the chest expansion. Okay. Can you take a deep breath for me? Okay, and it's symmetrical. And take a look at her spine while she's back here. All right, you can face towards me. Oh, wait, actually. While I'm back here, I'm also gonna check for CVA tenderness. I'm gonna percuss your back and let me know if you feel any pain or tenderness. Good? Okay.
Up to there.
I'm also going to have you shrug your shoulders against my hands. Thank you. Okay. So now I'm going to take a look at your arms. Let me know if you feel any pain, tenderness, numbing sensations.
Nope.
Okay, I'll take a look at her skin. It's intact, pink, warm. Take a look at her hands. Cap refill. Less than 2 seconds. I'm going to palpate your radial pulses. And they're equal bilaterally, strong and regular. I'm going to have you squeeze my hands. Okay, great. Okay, now I'm going to do your abdomen. First, I'm just going to inspect the contour of her abdomen. It's flat, it's non-distended, her skin is intact, and I'm going to auscultate in each of the 4 quadrants. And there are active bowel sounds, and if I did not hear anything, I could listen up to 5 minutes. Now I'm going to listen with my bell to the abdominal arteries. First the aorta, and then renal, iliac, and femoral. And now I'm just going to palpate in each of the 4 quadrants. Let me know if you feel any pain or tenderness.
Yep.
Good?
Yep.
Okay. You can sit back up. Are you having any problems with urination?
Nope.
No pain or blood in your urine?
Nope.
Okay. When was your last bowel movement?
Last night?
Are you passing gas?
Yep.
Okay, so no complaints there.
Nope.
Okay, so now I'm gonna take a look at your legs. Let me know if you feel any pain, tenderness, any numbing sensation.
Nope.
Okay, I'm gonna check your patellar reflex. Okay, great. Her reflexes are strong. Can you slide back a little bit for me? Okay, so I look at her legs. Skin is intact. There's no sign of any swelling. Gonna take your socks off. Okay. No swelling. The skin is intact. I'm gonna palpate your pulses, and this is the dorsalis pedis. Okay, strong, regular rhythm bilaterally. And then I'm going to do the posterior tibial. Okay, strong, equal, regular rhythm. I'm going to do cap refill. It's less than 2 seconds. Can you raise your feet up against me and then push down? All right, great. Okay, you can sit back forward. Okay. Any questions?
No, I'm good.
Okay, great. Have a nice day.
Thanks, you too.
And I document my findings.